Okay, see ya.
Hi, good morning, everybody, from a soggy London, and thank you very much to the WADM organisers, and particularly Alison Hutton for inviting me to do this. My name's Tina Endericks, and I'm Joint Director of the Public Health England WHO Collaborating Centre for Mass Gatherings and Global Health Security. Much of that designation was around that we did in planning for the London 2012 Olympics, and that's going to be the focus of my presentation talk today, and talk about the learning that we did from London 2012 and the how we're using that to support and work with Rio de Janeiro for the upcoming Rio 2016 Games, and about some of the legacy and learning that we can share with others. Um, if you can see it, there's a presentation online, but if that's not possible, I'm not sure, but I know it can be shared. Okay, so I was going to start off with just a bit of a background about mass gatherings and actually what they are. So kind of the WHO definition is that they're events that are attended by sufficient numbers of people for a defined amount of time to strain the planning and response resources of a community, state or nation. And there's various types of mass gathering. Um, I'm not sure if people can still hear me because
Yeah, still hear you.
okay, there's a lot of noise down my end. It actually
Yeah,
sounded like someone flushed the toilet.
I unmuted people, and I think it caused problems, so I've muted people again. Sorry.
Okay, thank you very much. That's okay. Um, so people can see my screen, can't they,
They
Ali?
can. Yep, they can see you.
Cool, that's good. Just so I don't have to read out the presentation.
No,
Um,
we can see you really
just
well, and the presentation looks good. So yeah, keep on going.
okay. Thank you very much, and apologise to everybody because this is the first time I've done a webinar like this, so it's a learning curve for me. So when we're looking at mass gatherings, we divide them into two and have planned and spontaneous mass gatherings. The planned ones are the easier ones to address because normally you have a long time to do all the planning and putting everything in place. And what we're trying to do now is taking the learning and experience from planned mass gatherings and applying it to the more spontaneous ones, such as refugee camps and protests and very short-term ones, such as Pope's funeral, which means a lot of people are in a new location very quickly, and there's not been the time to put all the logistics and processes and planning in place and what you would normally do. Okay, for some reason my technology is not working now. Okay,
That's me.
yeah, yeah, no, that's fine. Sorry, for some reason the slides weren't shifting. Okay, so as just some background on some of the challenges that can be found around planning for mass gatherings, there's a lot of issues that need to be taken into consideration, especially when planning ones such as the Olympics. In particular about the high profile sponsorship, they are hugely lucrative events. And one of the learning from London 2012 was around the fact that even if no one could actually attend the event for various reasons, they would still have run them because of the sponsorship and the TV coverage. So that was an interesting lesson for us. There's also, as you can imagine, and as you'll be aware, a lot of media visibility and interest in large mass gatherings. and also political interest as well, which drives an awful lot of the planning and preparedness activities, and the need to provide a lot of information and do the reporting and provide the assurance during the event that nothing's happening that might be impacting it, or providing a very quick response if something does happen. One of the big risks and issues now is the increasing global interconnectedness, as the flights and the speed at which the, infectious diseases in particular can travel globally is a serious concern, and has been demonstrated with the SARS and the Zika virus up to date. So we also need to look at kind of like the increasing public health threats around a mass gathering, about the context of the mass gathering, and kind of the setting of it. So the weather conditions, whether it's going to be hot or cold. In London, interestingly, we had to go from having flooding to having a heat wave, because we're never quite sure what's going to happen in our summertime. Also looking at trauma and crowd management, there's been quite a few crowd issues around mass gatherings. In particular, the Hajj last year had a major problem with crush injuries and traumas, which needs to be considered when you're doing your planning and how you can access and respond to that. There's also the introduction and dissemination of diseases, both those that have been brought into the country and those that might be taken back out of the country from the overseas visitors and participants. And also nowadays we also have to consider the CBRN side and the deliberate release and the potential for security risks and attacks. So one of the things that we look at when we're planning is around the control measures we can put in place, the additional things that we need to do above the normal business that can provide the assurance and the security around the public health aspects for mass gathering. Some of that is around looking at integrating and enhancing your surveillance to ensure that you know what's going on. I've mentioned the risk of potential international spread, and that depends a lot on the travel patterns and the participants, and that needs to be considered when you're looking at your planning, and also after the event about how things could transfer after that, and also mobile population. So if something does happen during an event and you have exportation of diseases and people travelling back home, how will you manage that and know what's happening globally, potentially for something like the Olympics? So on the reassuring side, the history says that we haven't had a lot of infectious disease outbreaks associated with mass gatherings, in particular the Olympics. So during both the Atlanta Games and Games in Sydney, there was about 1% of the healthcare was associated with infectious diseases, and most of those were the normal things that happen routinely within the country, such as food poisoning, gastrointestinal diseases. There was very little that's actually associated with the Games, and the evidence from London 2012 supported that. We had very little happen and nothing that was significant, and because of all the processes and systems put in place, we actually know with certainty that nothing significant happened. And that's one of the differences for a mass gathering. It's around that assurance that you can stand up and say that nothing significant is happening. And that's quite a different perspective of using surveillance in that manner, rather than you're normally looking for what is happening. So it's quite an interesting element that you need to think about when you're doing your planning. So just a bit of the processes and how we set up London 2012 and some of the learning from it. So when we started the planning, we took the principles of 3 planning steps about doing the risk assessment about what might happen and how likely that is, looking at the surveillance about how do we know what happens and what we do if something did happen, so the response element. We were very clear that because we had 7 years to plan for the Olympics, it was an event. It wasn't being handled as an emergency. We had all the time to plan and manage things, and then if there was something unusual happening and we did have an emergency, you can escalate and put your surge capacity into place. But it's around maintaining business as usual as much as you can, but also expect the unexpected, because there's always surprises come out. So the first thing we did was the risk analysis about what would normally happen in the country. And looking at the normal epidemiological situation within London during the Games time. The previous year we had over 400 public health incidents that were reported into our London teams. So when you put that into the context, and then you put the Olympic Games on top of that, that's a lot of normal things that happen in London because it's such a diverse community, and we have a population of over 6 million, which gets doubled daily with people kind of moving into the city. So that's what we manage all the time, then whatever else was happening, but it puts it into context about the number of things that are normally there. And one of the areas that we focused on was helping people understand what normally happens within London. And so when something was reported, you look at whether it's in addition and something unusual happening rather than actually this is normal business. We also looked at environmental hazards, whether we had to consider air quality. It's one of the issues that got raised in the planning because of the endurance events. They're very prone to poor air quality concerns, and London being an old city with a lot of buses and traffic in it, the air quality has issues sometimes. So that involved working with the Games organisers to run the endurance events in the morning when the air quality was better, and putting out detectors to identify if there were any issues and alerting people if there were issues coming up. So looking at what the mass gathering context will be, and looking at the scale, location, there's a big reputational issue around hosting something like the Olympics. I've mentioned the media and political agendas, which drive a lot of the pre-games issues and concerns, and also the scale of international travel. One of the things from London is that we have one of the most globally connected cities in the world, and have a huge travel hub through Heathrow, which is actually quite different from Rio, which doesn't have such a large travelling global community going through there on a regular basis. So there will be a different dynamic in Rio from what we would normally see in London during the Games. And looking at also what could be brought into the country, so looking at other infectious diseases globally that could be imported during the event, and the risks to the country of those coming in. One of the things for the UK is very fortunate is it doesn't have the mosquito vectors that transmit things like Zika and yellow fever and malaria, but we do still get cases because we have people travelling in with that, but there's no onward transmission. We were also worried about exporting measles across the world because of our the issues with the MMR vaccination in the previous years, and there was quite a large measles outbreak in the East End of London during the Games, but we didn't have any major issues with that. Mentioned the CBRNE and also deliberate events. We had the unusual situation that we had the tube bombings occur the day after we were announced as the hosts of the London 2012 event. So that raised awareness and raised the security risk considerably, and a significant amount of time, effort and finances was actually put into the security for the London 2012. You also need to look at your systems, your surveillance systems, your reporting systems. Are they good enough? What else is needed? Do they need to be more systems put in place or enhanced? There's a lot of questions about making sure you get the right information as quickly as possible in order to manage it and provide the response required. So how did we know what was happening? What did we do about enhancing our surveillance systems and the following up of any events that might happen? We put in we have quite a good surveillance system within the UK, but we still looked at the ways that we can enhance that, and about kind of the timeliness of that, about making sure we had daily information rather than weekly or monthly, which is what we would normally do. So kind of there's a large program about working on building that up. We also enhanced our microbiological services and put in additional tests, again to give a faster and more accurate response than we had previously. We set up a whole system of daily reporting, teleconference, and also a daily situation report, and that was all managed through setting up the C4 arrangements, the command, control, coordination, and communication, and also a concept of operations, not just for public health, but across health and then across government, because anything that happened during the Games time is linked to the Games, even if it's happening up in the north of England and not directly related. Everything happens that will have a link to the Olympics, but also making sure that across government, across transport, across our border controls, everybody knew what was going on, so they could, if there was any kind of links and connections and further work that needed to be done, everybody understood the situation. And one of the key things for us was setting up a single point of contact. It means that you have one email or one phone number that is available 24/7. Doesn't matter who's on the end, that number and that email address is known to be contacted. So if anybody needs to get hold of you quickly or an emergency, they use that. And that means that there's not different views and different bits of information being shared across different groups and organisations. We also set up so that we had a presence in the London 2012 Polyclinic. We set up reporting systems, but we also put public health experts in there to make sure that any information that was picked up really quickly, and also any response. And one of the advantages of that was to pick up soft information and encourage people to report and talk through if they had any public health concerns. And there was a process where we got information through from any public health incidents or any health incidents from all of the venues. So again, very quick information sharing and doing a rapid response if required to investigate it and prevent any escalation of any issues. Spent a lot of time setting up the good stakeholder working arrangements. Probably the last year, 18 months was spent building those and building up the trust and experience and understanding of the different organisations, the roles and responsibilities. And that was invaluable because there was a lot of soft conversations that went on when early warnings came through or alerts came through, so you could have a quick phone call with somebody, talk it through, decide how to manage it, and it became very, very efficient, very, very effective way of working. And that was literally sitting down, talking to people, spending time understanding their requirements, their needs, their expertise, and making sure that all kind of worked together. And of course the world went on. We had business as usual. Everything else in the UK carried on as it should do, including all the hospitals, all the public health, all the GP work. One of the things that's been a criticism of previous mass gatherings has been that actually it affects the normal health system in the host country, and that was one of the commitments from the UK that wouldn't be happening, and there was no record of that being the case. I mentioned that we were improving and worked on the surveillance system. So what we did was we added specific Olympic fields into our routine systems. So if somebody had went to their GP and reported something, if they had been at an Olympic venue or an event, they could actually be asked that, and that would be logged in the system. And we could detect if there was a pattern of people having attended one event, even though they might be dispersed across the country afterwards. We enhanced our syndromic surveillance systems. We already had some systems in place for our GPs and our health phone line, but we put it into our emergency departments and walk-in centres, because recognising that visitors to the country will not go into the normal country's health service, so they were signposted to go to the emergency departments and walk-in centres, so we needed to gather that information from the overseas visitors. And that's actually been a legacy for London 2012. We continue to maintain those systems as well. We also put in international surveillance systems. We worked with CDC and the European Centres for Disease Control to kind of get information from them and monitor all the normal resources and reporting systems that are out there to see whether there was a risk of anything coming into the country. And I've then mentioned about the environmental hazards, about the chemicals, radiation, air quality in particular, and we used a phone app called AirText to give alerts to people if there's poor air quality issues. So we do that routinely in London anyway, but we extended that during the games to visitors so they can see whether there's going to be any concern. So we put in a event-based surveillance system, which was around putting in criteria of is there an Olympic-related element to this report? Is there media interest in it? Is it one of the athletes, so that we could kind of actually prioritise those and focus on those and get more additional information on those. So I said we put surveillance systems into the polyclinic based on a syndromic process. It was an interesting experience, and they are doing something similar in Rio. One of the issues is you don't have any baseline data to actually judge whether you'll get seeing more cases than would normally be expected in that population. And we also put into the hospitals an undiagnosed serious infectious disease system, which if people were reporting into hospitals and all the routine tests were not picking up anything, an alert would come through just in case there was a deliberate attack or there was something unusual going on that we needed to start picking up. Again, very useful, but nothing was picked up on it. I mentioned about the enhanced microbiology services. We put in some additional tests. We put in a multiplex panel for gastrointestinal diseases and some respiratory diseases. One of the reasons for doing this is the speed by which everybody wants to know what's going on. So you can't say, well, we'll tell you in 48, 72 hours. We had a turnaround of 24 hours to be able to identify the common diseases that we'd be expected to be looking at and put additional reference capacity into place as well. So just a quick summary about the daily reporting and the diversity of the information we put in that. So we covered all the areas that's spoken of previously. We also had media reporting including in there, and that was quite often the driver for additional information and responses going on, because a lot of things would be picked up in the media or stories in the media that we're expected to respond to very quickly. The aim of this daily situation report was to make it as boring as possible, to be honest. So the summary box in the front would have nothing significant to report for the games, and we actually succeeded in doing that for the 3 months of the game time, so proud of that. This just gives you a very quick summary of the diversity of the data and information that we were feeding into that daily situation report and the process that we went through to get that. So for the infectious disease surveillance reports, there's a whole process of looking at our normal surveillance systems plus the enhanced ones, which will then get reviewed by our expertise in our infectious disease centre, and then we would get a summary report up into our main ops centre. But we knew that all that information was back in the specialist control centre, so if there was any questions or any issues or we needed a risk assessment being done, we could always go back. But the only contact with external organisers and other organisations was through the main Olympics Coordination Centre as a way of controlling the information flow and making sure you had that one version of what was going on. So what did we do on the response, the things that happened actually during the event? As I said, we had most of our normal processes, a few enhancements, but we had a very low threshold for what we would go to investigate and look into. So one of our colleagues in the Department of Health said that she knew more about the gastrointestinal habits of Londoners during London than she would ever normally do, because we would investigate a lot more cases than we would normally do, just to make sure that they were single cases, nothing significant, nothing that was going to have an outbreak aspect to it. We did have a few cases of diarrhea and vomiting. In particular, we had some norovirus in one of the training camps before the start of the games, which actually we heard about through social media, but I went in and actually actioned it and actually postponed the team going into the athletes' village, because obviously norovirus would be a high risk if that was transferred into there. But it did highlight the fact and the impact of social media now and the speed with which information goes out, very often before it will actually come through the professional channels and normal reporting systems. And that was a lot of learning for us about making sure that you were monitoring those and being able to very quickly say, there's not an issue, we're investigating it, but yeah, this looks like a one-off case. Very, very carefully worded reassurance statements were used most of the time for those. If there was anything going on, we did a quick risk assessment to see what the risk was and what the response should be, and any mitigations were put into post. We provided a lot of expert advice and information to people before the games about what would normally happen and how we'd normally manage it, and making sure that people like the media, we did a press conference beforehand so they understood the things that we were looking for, what we were monitoring, how we were doing it. And again, very useful because it gave that assurance that we were put things in place, we knew what was going on, so they could trust us basically. And we did a lot of information sharing across our key partners, and as I said, the proactive media, but also reactive media. About some of it's about managing rumours, some of it's about managing some of the interesting media that goes on in the build-up to the games. You've got a demonstration there, which is my favourite headline from the whole of the games, which is the March of the Killer Caterpillars, which are small 1-inch caterpillars that were in the west of London in the couple of months before the games, which cause a mild throat and skin irritation if touched. But that was the joys of media, of making it look far more scary than what it was. So one of the things that we spend a lot of time with, that I've mentioned, is around the partnerships, team building for the people involved during the Olympics within the organisation, but also working across our health organisations, across government, with international colleagues, in particular WHO, and the event organisers, the London Organising Committee of the Olympic Games. So we had people co-located with them in the planning build up, and also, as I said, in the polyclinic during the game, so they could have the discussions on the ground if something's going on. Media and communications was very key in the build-up, so we were doing monthly newsletters to people to tell them what was going on, making sure we had information on our intranet and extranet, making sure that we provided a baseline document of all the things that were normally happening, putting information up on the website. A lot of this was precautionary, but taking the view that actually if you tell people what's going on, it's less likely to cause problems. There was also an awful lot of work going on about health promotion activities with our colleagues in NHS London about how to access health services, how to stay healthy during the games, drinking water, so staying safe, having your vaccinations before you came into the UK. And also we did a weekly bulletin about what was happening, which again was relatively easy because there wasn't much going on to actually say about. I mentioned about the security issues as well, and so then looking at making sure our emergency planning and response systems were again enhanced during the games. We have very, very good systems within the UK. We've had a long history of terrorism attacks over the last few decades in the country, and we go through a lot of testing, exercising, building up that capacity and capability. And again, there's a lot of investment into that in the build-up to the games because of the perceived security threat. So it's around, again, enhancing the surveillance. How do you know what's happening? How will we respond? And the impact on the games. So one of the key things that we would always encourage people to do, and we spent the last year before the games doing was around the testing and exercising, both from the organisational level, across all our health departments, across government. We had 3 major cross-government exercises. The first one had 200 scenarios in it, just to test the data and information flows and the things that would happen all the time. It's the first time anything like that had been done, and it was a vast learning curve for all of us involved in the things that would happen all the time, but the things that would trigger that expectation of an additional response and an escalation up into the reporting systems. So just a quick summary of some of the key learning from London 2012, and then I'll go on to how we've kind of transferred that to Rio. So it's around making sure that you have public health represented at all levels in the planning and getting stakeholder engagement, making sure that you look at the things that you've already got and build on them. Do not start doing something new and different just before the games, because you won't have the background, people won't understand how it works, and you are potentially going to cause some issues if you do that. So normal practice as much as possible. Mention that normally it should be a planned event rather than an emergency, because you will need to have your emergency capacity there in reserve if something happens, and about providing information to people to understand what normally happens within the host country, so baseline documents. Single point of contact is one of our recurrent themes, about making sure you only have one person who is the link externally, to make sure that you only have one version of information going on and not different streams of information sharing. And the political expectations and the media expectations are probably one of the biggest things that be about for something like the Olympics, because it's the country's reputation. The media interest is intense. During the Olympic Games, we had about 20,000 journalists covering the event, and as soon as the Olympics actually started, the focus went there. But there was about 10,000 other journalists in London at that time in the build-up to the Games, and they're the ones who are interested in things going wrong in the country, the concerns that are going on. For us, there were security issues, there was transport issues, so there's a lot of stories in the few months building up about it's all going to go wrong, there's going to be problems, and they're the ones that you have to manage better well. I mentioned about testing and exercising, about looking at how you work on a daily basis and then escalating up to the emergency level, and providing the assurance that nothing is going on, or if we need to do it, that we knew what was going on, it would be reported, and we'll give the assurance that it's being managed appropriately. Very clear on the single version of the truth, so that only one spokesman says what's going on and does the reporting and media statements. And also about how you work across not just your own organisation, but making sure you've got concept of operations sorted out across health, across government, and all the partner organisations. And then about learning from others. So we spend a lot of time reviewing what has happened in previous events, other mass gatherings, talking to colleagues in WHO, involved in observer programmes, and also the legacy. So from London, our legacy that we left behind as part of all this planning was really good, and it's one of the things that should be considered when you start doing your planning, about looking at actually the benefits of the host country afterwards. So we actually have an enhanced syndromic surveillance system now. We have more rapid diagnostic tests, so the multiplexes we set up are still used routinely within the UK. Very good cross-work organisational working arrangements and dynamics and networks now. It also helped us to gave us an opportunity to raise the understanding of public health and raise awareness within the communities, especially around the venues. Very good working with partner organisations and building on that, and also building our emergency planning and response capabilities, and building that into the global health security agenda going forward. We also did 2 reports. We did an internal HPA summary report, and then we did a Learning from London report, which the links are there if people want to access them. There's also an opportunity to have a broader legacy, not just for the host country. So one of the things we were looking at is around improving the planning for mass gatherings across the globe and how we could share our learning and expertise. So since London 2012, the collaborating centre here and the network across the globe are spending increasing amounts of time and sharing of expertise with other people who are delivering mass gatherings. So we've been working very closely with Brazil for a number of mass gatherings over a few years, the Olympic Games in Glasgow and the upcoming ones on the Gold Coast in Australia, worked with FIFA on the World Cups and the Hajj and a number of other countries, but it's an ongoing piece of work that actually helps people understand what's required and also being the source of expertise to support and help them do that. As I mentioned, we've got a network of collaborating centres on mass gatherings globally. There's 5 across the world at the moment who have different areas of expertise, and we have a virtual interdisciplinary advisory group that we have access to a whole range of expertise that we can reach out to if there's queries and issues from those planning mass gatherings, so we can support them in that way. One of the things we encourage people to do is run observer programs, and we did that during London 2012, and also encouraging other countries who are hosting gatherings to do that as a way of sharing the experience on the ground during the event, but also their learning and development and the planning processes and actually what happens during events, so we can get a different perspective. What we're trying to do is build up that, because at the moment that's been very much sports event focused, so getting that broader knowledge and experience is kind of a focus at the moment. There's obviously a opportunity to put publications out. There was a Lancet review on different mass gatherings that was published in 2013, I think. And there's a process of developing a number of testing and exercising tools, so people planning mass gatherings will have access to them, and also that we have a toolkit that people can use as a planning tool and an audit tool to review their processes and systems and what they need to do as part of their risk assessment, and then monitor performance and improvements in the build-up to the event. And we've developed, the WHO have developed the new guidance on public health for mass gatherings, which was launched last April, and we're in the process of developing some training resources for that, and have been using them in Turkmenistan and in Kingdom Saudi Arabia for the Hajj planning for this year. So a series of ongoing work that's once you're involved in mass gatherings, it does tend to be an ongoing piece of work. Just a quick kind of like demonstration of the numbers and types of mass gatherings that the WHO and the collaborating centres have been involved in over the last 4 or 5 years, and the calls for expert involvement and engagement is increasing because people are understanding the benefits and also the risks about holding these events. So briefly about transferring from London to Rio de Janeiro, it's worth just highlighting that Brazil have had a number of mass gatherings over the last few years, so they've been building up on the level and engagement and involvement and learning from that. So they started with the FIFA Confederations Cup in June 2013. They also had the Pope's visit to Rio de Janeiro in July 2013, in which they had to change the venue for when he gave one of his speeches very quickly, and they actually had 3 million people on Copacabana Beach listening to that, which is a phenomenal number of people in quite a small space. And again, it picks up the things that you wouldn't normally expect because people were in the sea. So, you know, there's risks around that, and there's also risks around water quality on Copacabana Beach sometimes. So different issues came up because of the speed with which that was done and the change of location and looking at, you know, the impact that might have on the event. They hosted the FIFA World Cup in June-July 2014, and WHO were involved in that, and also they ran an international observer programme. which was useful. And what they've been doing over those is building up their expertise, their knowledge, their reporting systems, their processes, and learning each time. And that is building up to their capacity and capability for the Olympic and Paralympic Games that are starting in August this year. And it's also worth remembering they have the Carnival every year in February, which is a major event. And for all those events to date, there have not been any significant public health issues. So it's just about the work that we've been doing about transferring our knowledge and experience from London. So we had 8 delegates from Brazil come over to our observer programme in London, and during that it was a week-long process where we went through all the planning that we've done, everything that's been happening, how we worked, and we shared all our expertise, all our documents and planning and processes and reports with the team from Brazil and the other delegates from across the world who attended that. We also ran a training workshop for them in March 2013, both for the FIFA but also looking at Rio 2016. And they've been using the WHO toolkit around the key considerations too, and their risk assessment process. As I said, they ran an observer programme during FIFA 2014, and we were involved in that, and they are planning on for Rio 2016, but the dates have yet to be confirmed, and the collaborating centres and WHO will support that as well. One of the things from PHE's perspective is that we've been working very closely with WHO, Rio 2016 team since they were set up, and also the IOC to provide public health expertise and advice, and also the Brazil Ministry of Health. So what we're doing is sharing our experiences with others, so to help them do their planning and understand the risks, and also around providing the technical expertise when required to them. So for Rio 2016, we've been providing technical support on water quality issues, because there's some concerns around the water quality for some of the sports events. We've provided travel advice, we've been helping them respond, give the technical input into media inquiries. Zika is obviously one of the key ones that we've been supporting as well. And also Brian McCluskey, who's the other director of the collaborating centre here, will be in Rio as part of the IOC as a public health consultant during that time. So that shows the importance and perception of public health from the IOC Rio 2016 perspective, and the need to have that expertise on the ground. So when looking at Rio, they've done a lot of work on looking at their risk assessments and reviewing their processes and systems, and looking at the learning from their previous mass gatherings. There's a difference in as much as most of the venues are based in Rio de Janeiro. There's another 5 venues across Brazil, which are just for the early stages, and it goes up to the semi-finals on the football, and that's one of the aspects that needs to be taken into consideration for this, because Brazil is such a huge country that the infectious disease risks vary depending on where you are and your location. But with the majority of it in Rio de Janeiro, that means it's easier to focus on those, and particularly when you think of the vector control activities that are going on around the Zika and chikungunya and dengue, and what they're doing to kind of reduce the risk of that, and the advice that's going out on that. I've mentioned the recreational water quality. There's been a lot of remedial work going on in the Rio area to reduce the risks of that, and that's ongoing, and there's additional testing going on to monitor that and to enable a decision to be made on whether there's any issues that might cause a risk during the events, and whether they will change the events or move them in the unlikely event that that happens. There's a risk around foodborne diseases as they happen all the time, but also encouraging people to have healthy behaviours and eating good restaurants and good hygiene. There's influenza is a risk because it's a southern hemisphere flu season, so it's around kind of considering that and the impact on people coming from the northern hemisphere, and encouraging people to have their vaccinations before they go there as they would for their their host countries' routine vaccine schedule, and also heat stroke. And they do have, when it rains in Rio, it really does rain, and I can say that from experience of paddling through some puddles recently when I was there. I will mention Zika because it's going to be one of the things that people are interested in. So one of the things that you'll be aware of is WHO has convened an emergency committee on Zika in February this year, and they had their third meeting in June. And during that, one of the areas they were considering was whether there was an increased risk of Zika transmission globally related to travel around the Olympics. And they had a lot of expert advice and input and review of all the evidence that was out there. And the conclusion was that the risks are not significantly increased by hosting the Rio de Janeiro Games. So there's been quite a lot of media coverage on that, but the evidence is very clear, and there's ongoing research as well to support that. That's partly because of the seasonality of the mosquito, and also kind of like the preventative measures that they're putting in place during the Olympics in the Rio de Janeiro area to reduce and control the mosquito population, and the advice they're giving to the overseas visitors. So just to highlight some of the pressure that Brazil is under at the moment around the number of stories around the water quality, obviously the Zika issue, but also kind of like the rebutting of some of this information, and the positive view that's actually being taken within Rio and Brazil about it will be good, and they will do it well, and they have a very, very good view on this, and that's why I put that quote up there. And then it's Brazil. There's often things going on. You know, they've got a lot of political issues. They've got economic issues, but they will host the Olympics, and it will be successful. So I will stop talking now, and I will take questions. Thank you.
Thanks so much, Tina. Just if people, what you need to do is you need to unmute your microphone and then ask a question. But just to get the ball rolling, I've got a question here from Mike Hill's already lined up. So Mike, I'll just read out your question to Tina. And the question was, how did you translate systems of surveillance for Olympics into large capacity games? It is now 2016, so what is left? How's that for a good question? Can you read the question, Tina? Like on the right-hand side, there's a panel of questions. Can you read them? Mike, do you want to unmute your microphone and talk, or I can unmute you? I'll unmute you. Are you still there? Do you want to talk? Okay. The other person that did ask a question was Vicky Wright. Vicky, did you want to ask a question? Okay, I'm just going to unmute everybody and see what happens. It got really noisy. It got noisy last time I did that, but we'll see how we go.
Hi, it's Vicky here.
Ah, there you go. Hi, Vicky.
Hi.
Hi. Most of my questions were actually answered and during the slideshow, so I just asked it at the start, just about hospitals and planning for what hospitals would do specifically.
Okay, yeah. So there was a piece of work around identifying which hospitals will be used for overseas visitors or athletes, and they have certain accredited hospitals for the athletes and the Olympic family, and then visitors, and then the usual public. And there was a whole series of activities going on about ensuring they had the capacity and capability, and putting the surge capacity of nurses and doctors in there, and how they would manage the data and information flows if people go in there. There was very little use of the hospitals during the games time. There wasn't really a significant increase of access and use of the systems. There was very few athletes who were transferred to the hospitals because most of it, the medical concerns were managed in the polyclinic. But we knew and we tested the kind of like the hospital capacity to deal with mass casualties, CBRN events. But we do that all the time. We have a whole ongoing programme of that within the UK, as most countries do now, about how they will manage that. So for a major tube accident, kind of like a dirty bomb, kind of like a collapse of a building. So we went through those processes and reviewed them to look at the Olympic additionality around the different people who might be there. So the overseas visitors and the language issues, and making sure that we could address them. But it was building the robust business as usual model and looking at that difference and making sure that it was fit for purpose and could have dealt with any major issues and incidents that happened, but nothing did to test that. So yeah, I hope that answers your question.
Okay, we've now got a question. We've got two questions. Oh, sorry. Go, Vicky.
Yes, that does. Thank you so much.
Lydia, Maina and Dr. Nader Mehta want to answer a question. So, Lydia, how about you go first, and then we can get Nader to go second. Don't you love technology, Tina?
No, I was just saying thank you. That does answer the questions.
Thanks, Vicky. Lydia, are you on? She's got a hand up, and I've unmuted her. All right, perhaps. Yeah?
Okay, now you're right. Tina, can you hear me now?
Yeah, hi Lydia.
Hi there, Tina. Tina, how, what are you going to, what are the resources you may have available to you, considering the very poor quality of water in Rio and consequences of athletes and visitors drinking this very poor quality water and what may happen? Like, I'm thinking of quite a large outbreak of whatever could happen from dirty water. Over.
Okay. Thanks, Lydia. There's two issues, I suppose. So for drinking water, the recommendation is for people to drink bottled water, as you would normally do if you're travelling overseas. The Brazilian water quality is actually good, but because of the potential that it's a different type of water and people are travelling, so recommending bottled water, and that should reduce that risk. As far as the event and the water quality on the beaches there, Rio have put in place remedial activities to reduce the flow of sewage onto the beaches and also into the Lagoa, where they've got the canoeing and rowing events. And there's been a lot of work going on to reduce that, and a lot of testing going on to provide the assurance that that's been fit for purpose, and they've considerably reduced the risk to that. What they've done is set up a risk assessment process looking at the water quality testing results, doing a sanitary check, a visual check on the locations, and also looking at the weather, because if there's a lot of rain, you'll have more sewage run off, so you increase the risk of having contaminated water. So what they've done is the remedial work and put in the process the risk assessment, and they will give advice both to the public about kind of like the quality of the water on the beaches if people are going to go and enjoy those, and also for those participating in the events. The evidence that I've seen is that the water quality has improved considerably, and it seems to be quite an effective system, but that's an ongoing process and system. So we're continually reviewing and providing technical expertise into that and advice on that. Over.
You okay, Lydia?
Yes, thank you.
Okay. All right, we've got quite a few people lined up. How much time have you got, Tina?
Uh, at the moment, I'm okay, but I might get thrown out of my room in a minute or so.
All
But
right,
as long as I'm sitting here,
okay.
I'll be okay.
Well, Mike Hills is, I don't know, he's having trouble with his microphone, but I'm just going to unmute him again and see how he goes. So, Mike, if you've got a question, just have a go, because according to me, your microphone should be working. And if not, we have, who else has asked you a question? Oleg would like to know what was the total number of patients during the London event?
Hello.
Hello.
Hi. Patients, there's quite a few different categories of that for hospitals and also the athletes. I'm not going to be able to give you a figure, to be honest, but it was not a significant increase above what we would normally see in London during that time. I can dig it out and I can share that information through Alison to people. Apologies, I haven't got that to hand.
That's all right. So if anyone else got a question, maybe we'll make this one the last one.
Yes, hello. I'm Dr. Nader from Saudi Arabia.
Hi, Nada. How are you?
Hi.
Yes, how are you? We meet before in Jeddah for 1 week of math gathering in Jeddah for I think 4 months.
We did when we were doing the training with you. Hi.
Yes, yes, yes. I think now your lecture it is full of good knowledge and just I think it just to increase my knowledge from your side and from the what you said in London Olympic and what you will do in Rio de Janeiro in Brazil. But you mentioned something about Hajj this year. Did you have something about Hajj this year, or did Minister of Health contact with you about the about the Hajj this year?
It was just mentioning the training program that you were involved in, and that was helping the planning for this year. So yeah, just highlighting the kind of like the sharing of the knowledge and expertise across the different mass gathering events.
Yes, and also share it before 4 months. I think for 1 whole week. It was a very successful week. We are all thank you for you.
Thank you. We enjoyed it as well. So yeah, hopefully it will be the start of many others.
Hey, Tina, can I
I
just...
hope I will.
Oh, sorry.
Hope I will attend it.
Can I just put in, I know I said last questions, but Mike he's been having microphone troubles, and he typed in some questions while you were talking, and he says he's listening, he just can't get his mic to work. So he just wants to know, is it your feeling that since the Olympic Games that the earlier reporting of significant infectious events has been enhanced?
Yeah. I mean, certainly building up the syndromic surveillance systems has been a benefit to the country, and we use that as an ongoing tool to kind of as an early alerting system. It includes our telephone reporting system, our health line that the public use, and one of the things that's been demonstrated from that is around it picks up the flu season, kind of like an early start to the flu season, as people tend to phone up and say they've got symptoms, associated with flu, and we can start to see that trend increasing before people go into the GP and you start getting the confirmed testing being done. So it's been useful. We've used it for some of the ash clouds and volcanoes issues, and it's an ongoing piece of work that actually, yes, we have a weekly report from them that gives kind of alerts of unusual diseases or quite low level things happening across different regions within the UK as well. So absolutely, and I think the practice of people realising that there's a benefit for reporting things quickly and being able to respond better and quicker has definitely work through into our public health system as well. So, yeah, definitely perceiving long-term benefits from that. Thank you.
Thank you very much. Well, I'm just going to thank everybody for taking part in the webinar. I can see there's a few other questions that people have asked. So, Tina, if I collate them, do you mind if I give people your email and you can answer some later?
No, of course not. That's no problem at all. I can do that.
But on behalf of Wadham, we just really want to thank you for taking the time out of your busy day. But I hope it's a good day. And for talking to us.
Thank you. It's been my pleasure. I've enjoyed it.
Okay. All right. Well, you're free now. So thanks, everybody.
Thank you. Cheers, Ellie.